We will be seeing arthroscopy assisted transosseous lower trapezius transfer using the Arthrocuff transosseous system. This is a reusable transosseous system. A standard rotator cuff repair using the system has already been described by the senior author. A 62-year-old male patient with chronic massive retracted rotator cuff tear will undergo a lower trapezius transfer. The patient is positioned in a standard modified lateral position. Diagnostic arthroscopy is performed. A massive rotator cuff tear, which is irreparable, is identified. The scope is then switched to the subacromial space to clear the subacromial and subdeltoid bursa. Rotator cuff footprint is prepared and a posterior transosseous tunnel is made. And all is used to make a pilot hole. The transosseous jig system is introduced into the pilot hole to complete the horizontal limb of the transosseous tunnel. The transosseous tunnel is in an L-shaped configuration with vertical and horizontal limbs. After completion of the horizontal limb, a special screw lock mechanism is used to shuttle the PDS suture through the transosseous tunnel. Using this suture, three fiber wires are shuttled into the posterior transosseous tunnel. One of these fiber wires is used to repair the infraspinatus to its footprint partially. After partial repair of infraspinatus to its footprint, attention is directed to create the anterior transosseous tunnel. A pilot hole is made for the anterior transosseous tunnel. The transosseous jig system is introduced into this pilot hole and the horizontal part of the tunnel is completed. A special screw lock mechanism is used to shuttle the PDS suture through the transosseous tunnel. Using this PDS suture, three fiber wires are shuttled into the anterior transosseous tunnel. One of these fiber wires is used to complete the biceps superior capsular reconstruction, which will augment the lower trapezius transfer. After completion of biceps SCR, Peroneus longus graft is harvested and prepared in a standard manner. A horizontal incision is made in the supromedial aspect of the scapula to isolate the lower trapezius tendon. After isolation, the Peroneus longus graft is passed from the horizontal incision made for the lower trapezius tendon into the subacromial space between the infraspinatus and the deltoid under the infraspinatus fascia. This is done with the help of a suture retriever. The attention is then directed to fixation of the Peroneus longus graft to the transosseous tunnels. This is done using two fiber wires in the anterior and the posterior transosseous tunnels. The fiber wires are passed through the Peroneus longus graft and tied laterally. After fixation of the Peroneus longus graft to the transosseous tunnels, the Peroneus longus graft is attached to the lower trapezius tendon with the arm in 60 degrees of abduction and maximal external rotation in a pulvar taft fashion. The integrity of the lower trapezius transfer is then finally checked using serial external and internal rotations.